Hi everybody, my name is Kieva Hranchuk and I'm the Clinical Director at the Scottsdale Children's Institute. I've been asked to answer this month's question, which is, what is good ABA and how do you know if your child's getting good ABA? So I wanted to start with a little bit of a disclaimer about ABA. ABA stands for Applied Behavior Analysis, for those of you that don't already know that. And ABA is the science of behavior for all living organisms. So it's a proven science. Often you hear, I'm anti-ABA. And my response to that is, it's kind of hard to be anti-ABA because ABA is a proven science. What you can disagree with is the way in which services are delivered based on the principles of behavior analysis. So there is good ABA service delivery and not so good ABA service delivery. So what I'm going to talk to you about today is what makes ABA service delivery good. So I would say the best way to tell is look at your child. Do they seem happy? Do they seem motivated? Do they want to come to school or therapy? It's a really good indication if your child is happy and motivated. It means they're having fun, and it means that the therapist is doing a really good job, pairing positively with them and just making sure that they're following the child's lead, following the child's motivation, etc. Another thing that makes ABA service delivery good would be that it's evidence-based. So what that means is we're doing things that we already know works. And so what goes along with that is, asking yourself the question, can you notice measurable changes in your child at home? Because if we're using evidence-based practices, then we should see the child progressing, and therefore you should see positive changes in your child at home as well. Another thing that goes along with that point is progress should be monitored consistently. So make sure that your child's therapist has a set of rules about when they're going to make decisions about your child's progress. Ask to see the graphs. Go into the agency, say, hey, can I see my child's graphs? If it looks like your child's progress has been going kind of at the same level for a significant amount of time, you might want to ask some questions. Say, hey, it looks like this isn't working for my child. Can we change the way that we're teaching? So another thing that goes along with that point, everything's kind of connected, is that good ABA services should be individualized. So cookie cutter programs don't work. No two children are the same, especially, two children on the spectrum. So we can't use the same, methods with every child. We really need to be setting up instruction for that specific child's success. So basically, we need to have individualized curriculums that are designed to ensure that your child is meeting goals that are appropriate to their level of functioning or development currently. So also, ABA is supposed to be very positive. It's supposed to be fun. It's supposed to be both structured, but also in a natural, incidental setting. If you find that your child is being delivered services where, they're just drilling them with questions repeatedly and your child doesn't seem to like that or doesn't seem to be responding well, it might be a good idea to kind of ask, hey, can we try something different? There are tons of instructional procedures and tactics that can be used within the field of ABA, and good therapists should be able to pull from different areas. Another thing is a lot of programs focus on problem behavior management or dealing with problem behaviors that have already occurred. And while that's important because we do have to help children who are struggling with problem behavior, it's important to focus on skill acquisition too. If you're teaching a child how to appropriately deal with a situation or a problem and you're setting up with them with the tools for success, then that problem behavior shouldn't even be happening in the end. So make sure that your child's kind of goal book is made up of both programs that are targeting some needs, but also targeting, just learning new skills. The last two things I'd like to say too is good ABA services should involve consent and transparency. So make sure you know what's going on with your child. Make sure you have been asked if it's okay to, teach your child certain things. And if you're finding it a struggle to be able to go in and watch your child, I think that would be a red flag. We shouldn't be treating your child in any kind of way that would make you feel uncomfortable. And we shouldn't be treating them differently if you were there or weren't there. So if you do feel like your child is kind of, everything's kind of a little bit secret and you can't just go in and watch them whenever you want, I think that would be a red flag in my opinion. The other thing to consider is just, what does the environment look like? Are you leaving them somewhere where you would want to be all day? Is your child in a small room with no windows? Are the staff trained? Are they friendly? Does your child seem receptive to them when you arrive for therapy that day? So yeah, that's my 2 cents on that question. I think there are many different components that make ABA service delivery positive. There are some that would make it negative, but those are a few of them, and I hope that that helps when you are trying to decide where to send your child for therapy. Thank you.